Thank you everyone for joining us today. If this is your first event with Sprinkles Parents, welcome. We're an activities, education, resource community for families in the Bay Area to help us thrive. I try and say we're the village it takes to raise this kid, or the handbook you forgot to receive at the hospital to help us all parenting and during these hard, crazy times. So thank you guys so much for joining. Today, we're going to learn about relief from teething with our great sponsors, Alameda Pediatric. I'm going to hand it over to Allison to take it from here. Thank you so much again.
Thank you. So I'm from Alameda Pediatric Dentistry. I am the Director of Communications, and I'm here with Dr. Maral Mobashar, one of our amazing pediatric dentists. We're so excited to meet everybody today and to go over teething remedies and so much more. And then we do have a special offer at the end of the presentation as well. And I'll go ahead and pass it over to Dr. Mobashar.
Hello, everyone, and welcome. I just want to say, first of all, congratulations. It's nice seeing the ages of your little ones. I have an 18-month-old, and I know this time can be magical, but at the same time a little stressful. So it's nice to have this community together, and we can definitely address your questions as they come through. So as we present, you're more than welcome to ask questions on the side, and we'll go ahead and field them as they come through. Just a little bit about me. I've been working in pediatrics for quite a few years. I have lived on the East Coast and the West Coast, and I have made Bay Area home. So I am just like one of you guys, a first-time parent. We're still teething in my household, so we're in it together. I hope that both we can give you some medical information, solid scientific information, as well as some, mom tips. So so we're here together. This is what we're going to be talking about overall. We're going to talk about timeline. We're going to talk about remedies and a lot of big no-nos that unfortunately colloquially are accepted, but not necessarily scientifically useful or safe. So we're talking all about that. And again, we're here to answer any questions you might have. All right, so we see on our side that we have quite a few little ones that don't have any teeth. That's normal, of course. Most little ones are born without teeth. Just in case you have any friends or family members that might ask, again, seems like no one has teeth yet below age 6 months, but little ones can be born with teeth right off the bat. This is called a natal tooth, or they can have a tooth the first month of their life. That's called a neonatal tooth. These are, generally speaking, unfortunately, their primary teeth. They're not extra teeth. They're their milk teeth, and oftentimes they are loose. They don't have a whole lot of structure to them, and most of the time they do need to be removed quite early on. But seems like we're not the problem we're dealing with. If anyone is dealing with it, I'm more than happy to answer a ton of questions on it, but I figured I'd touch up on it in case anyone is managing that. It can be ouchy for moms nursing as well. So not a common occurrence. I've only seen it once or twice in a hospital setting. Anyone dealing with this at all? Doesn't seem like it. That's good. That's very good. Okay, most little ones don't have teeth. All right. Teething can start anywhere between 4 and 6 months on average. Again, those little ones around 4 months, ouch for mamas. It can happen quite early, but it can also start around 6 months. That's average. 6 to 7 months is when we hear most kiddos teething. However, for some of our parents who are asking 6 months no teeth, do not stress about that. Some kids can go till age 1 without any teeth. To give you a funny anecdote, one time I had a mom come into Alameda Pediatric Dentistry a few years ago and ask us to take x-rays of the child's jaw. She was 12 months old and had no teeth. We didn't do that, thankfully. A month later, the tooth poked in, and thankfully the baby's perfectly normal. Again, nothing to stress about. Every child is a little bit different. They are on a different timeline. What we care a lot more is the pattern and the order at which the teeth are coming in, which is a lot more significant and important rather than the timing of it. There is also correlation, just for later on, between the timing of the baby teeth coming in and the timing of permanent teeth coming in. So the little ones who start around 4 to 6 months are going to lose their baby teeth earlier compared to the ones that are going to be closer to 12 months. Okay. This is another little, again, this is down the line for you. You're surviving your first year as a parent, but just so you have this at the back of your mind, just like we talked about birth to 6 months on average, there are no teeth. 6 months to 2.5 years, you're going to see most kids get their teeth. But again, with a little bit of an asterisk, I've seen this go until age 3 for our late teethers. They can take a little bit time longer to get their teeth. And again, we're going to start losing some of our teeth around age 6 years. That's again average for our 6-month-olds who got their teeth. And again, this can go on much longer for some of the later teethers. There are risks, there are perks and benefits to getting your teeth earlier. You can chomp on food a little bit earlier if you get your molars as a little one. But then some of our little ones get cavities faster too if they get their teeth too fast because they're still falling asleep with milk and things like that. So either way, it's normal, it's okay. Depending on their stages of development, we can manage it between oral care and also helping them with the teething process. All right, that's a big one we have a lot of families from what I'm seeing around 4 to 6 months that are here with us. So this is going to be really helpful recognizing that why is your little one acting a little funny? So let's talk about this quite a bit. We're going to see a lot of on and off irritability. So I say this as a mom more than as a pediatric dentist. I've seen my kid just be off. Is fussier during the day. He's not sleeping as well if otherwise he was for a period of time. And then his fingers, these little guys, they're just going to start going in nonstop. And some of that all might be consistent, but all of a sudden I see dollops of drool on the couch and on the chair and on the bed, and you start putting it together. That's what's happening. So the child's teething, especially the first teeth. Again, it's not, you're not used to it, or what is going on with the child. I really want to make a big point talking about fever. This is really, really important. Oftentimes, people believe that kids can get fevers from teething. Just a little note, real fever is above 100.4. Below 100.4 is a low-grade fever. It's not technically and medically a fever, and that is the type of fever you're going to see with teething. It's going to be below 100.4, oftentimes below 100. The temperature can go a little bit higher, but it really doesn't ever broach that 100.4 that medically be considered a fever. So I say this because this is the season that has been very rough on parents. I really hope that you haven't had too hard of a winter with viral diseases in your home, especially if you just have an infant. I hope that it's mainly the toddlers that are dealing with it, because I know it can be scary with infants. Nonetheless, if the child is having 100-point fever, above 100.4, I encourage you to think about other sources. The child might have contracted a disease, and you want to really monitor that closely and start thinking about fever management very aggressively. And I'm seeing on the chat that there are some children that are getting red cheeks. That's absolutely correct. Sometimes they can get red cheeks. Believe it or not, sometimes they might be pulling on their ears. This is something one of our pediatricians told me about, which gets further confusing if they have middle ear infections. That's something to keep in mind. So it is really hard for that first 2 years of life when they're not speaking a whole lot. Yes, the cheeks can get red, but again, unfortunately, parenthood is a very, very confusing for those early stages, because they might have eczema. They might have a really dry skin. They might have, God forbid, there might be an allergic reaction developing. So you want to kind of put all the signs together. So it's not just the red cheeks. It's not just the irritability. It's not just that low-grade fever. It is all of the above. And I have to say, in my experience, even though I do this for a living, it always takes me a few days to catch on that he's going through a patch of teething. And in the early stages, the first few teeth in the front, when they come in, those are quick. It takes a few days, you catch on, and they kind of poke through after a week or so. The back molars, in my experience, can take a while. You might go through patches and patches of teething. It might take months. For a week he's irritable, and it gets better, and then another week comes along, the child starts drooling heavily and is really upset, waking up screaming in the middle of the night. So I would just encourage you to definitely put all the signs together and not just one. And again, once the teeth start coming in, you'll start catching on. It gets easier as you see that coming through. And I see another parent commenting about their 17-month-old, that the child's not eating too much. Absolutely, you might pick on a pattern of and food preference. So you're going to see them prefer softer, colder things over harder, crunchier, hot, warmer foods. So that's another thing I encourage you to pay attention to as the time comes. You might notice they're putting more rougher things in their mouth. That might feel good. It might itch. So that can all certainly be signs. So just to recap again, put all the signs together. You might see red and swollen gums. You might not. Again, the teeth, some of the bigger teeth take a while to come in, and you might not immediately notice that redness. Last thing I will say as a word of caution, sometimes when those molars come in, you might see actually a bruising over the gum. This is called an eruption hematoma. I would encourage you in this type of case to consult a pediatric dentist if you can, because it can look scary. It might be normal, it might not be normal, but generally speaking, they are normal. I'm getting a question, how long is it typical for symptoms per tooth before and after tooth erupts? So that's a very good question. Unfortunately, this varies quite a lot with children. Every child is going to be a little bit different. And also depends on the teeth. As I said, the front teeth, it's very quick. It's usually a week prior or 2 weeks prior that you're going to experience these things. The one good news is once the teeth fully poke in, there is relief. And so you're not going to hopefully see too much of that afterwards. This is again with the asterisks, because the back molars, as they come halfway, that might still be a little bit painful. Food might get stuck under the gums. So just making sure you clean the area well. Is mild bleeding normal? Yes. Anytime there is any form of tooth eruption, this includes permanent teeth, there's going to be inflammation in the area because teeth are breaking through bone and gum. So a minor bleeding is normal. However, you see consistent bleeding, there might be other causes that we're more than happy to evaluate for you. We're going to continue talking about remedies now. So please feel free to send in questions if you need. There's a question that came in a little bit different, but I see that we can always address it because it's a big one we get in pediatric dentistry. And it is, I have a 6-month-old, when do I start oral care? So we recommend, believe it or not, even rubbing the gums or brushing the gums before the teeth come, but that's not entirely necessary always. As soon as the first tooth comes in, you want to start brushing the first tooth. And in pediatric dentistry, we do see children as early as first birthday or even first tooth. That's what the American Academy of Pediatric Dentistry recommend, first birthday or first tooth. And that's absolutely up to you. And what I love about that is that we can answer all the questions. We can work on prevention rather than damage control. We can work on diet, oral hygiene, habits to make sure we set the child up for success. So if that's something you're interested in, pediatric dentists will be a good place to start. Continuing with our presentation on teething remedies. So this is a big one, and I really hope that this helps you as you go through the frustrating and long process of teething. Especially with the first little ones, with a clean index finger, believe it or not, just like a gentle massage and rubbing the gums is really nice for the children. There is a lot of inflammation and discomfort in the area. They really like that. That's the reason they like putting their own fingers in their mouth. That's why they like plastic things in their mouth. Sometimes the pain can transfer. There's something called referred pain where the whole face might hurt. Sometimes the ear might hurt. So a little gentle massage on the face can also be helpful. There is a ton of stuff on the market for teething rings. This is where we enter the field of what to do, what not to do. Plastic, cold, silicone type of teethers are wonderful. So if you want to put the stuff in the fridge or have a few in the fridge so you can offer to the child, that's I highly encourage you to do so. The FDA cautions against anything frozen for teething. That's really important because that can cause frostbite. So be careful about that, and it might really burn the area that's already uncomfortable. I also want to further talk about other foods that can be cold versus frozen. This is a really big one. You might hear about frozen breast milk or formula. That's a really nice one. But if you freeze your breast milk or formula in ice cubes, I encourage you to crash it and then put that inside one of those silicone feeders. They sell these like silicone mesh sometimes that has a handle. So our 6-month-old are going to start being able to hold those. And they can kind of suck and gnaw on that. That way your child is not, God forbid, by accident, biting off a big chunk that they can make him choke. And also you're preventing frostbite from a big chunk of frozen thing on the gums. Some of the other foods that are really helpful for this, if you have a cold mashed banana or apples or carrots, that's a really nice one. If you even have it frozen, let it melt a little bit, again, crush it, put it in that feeder. They really enjoy that. Another good mom hack that I've heard about is dipping a like a washcloth or any clean cloth in a little bit of milk or juice. I don't like juice because juice gives them cavities, but a little bit of milk or water, and keeping that frozen, again, not immediately frozen, let it a little bit cool off, get a little more just cold, and then the child will really like gnawing on that. Overall, what we worry about is frostbite with frozen things. We worry about choking, so be really careful. If you're also offering cold foods, you want to be careful about the size of the food has to be age appropriate. This is something I did a ton of study for my little one. There is an organization, if I may recommend as a parent, not as a pediatric dentist, called Solid Starts. That our pediatrician recommended. It's a wonderful organization, similar to Sprinkles, where they have a lot of educated professionals, feeding therapists. They have an app. They tell you what size food is age appropriate. So around 6 months, you might be able to give a big thing of banana. Around 9 months, all of a sudden the child might choke on that. So be really careful about that timing. The size of foods is really important depending on child's stage of development. And again, with any form of inflammation, if you've ever had a twisted ankle, your mouth is similar. You're going to enjoy cold and soft things in the area. This is over the counter. I know you must have heard this, Tylenol and Motrin. When patients come and ask me, unfortunately, I don't have any other real solutions other than Motrin and Tylenol. But you really want to be careful about that too. You don't want to do it too many times. You don't want to do it too often. Motrin is ibuprofen, which can hurt the little baby's tummy if you do it too much or with an empty stomach. So all of this with caution, not super often, but if necessary. If the child is having a really bad day, having a really bad night, you haven't slept in days, do not hesitate to give a little bit of ibuprofen after dinner and let them sleep. I've done that myself many times. So keep that in mind. And again, make sure you pay attention to the dosing, to the weight of the child. And again, make sure we're not doing it too often, both in terms of the 6-hour period that they should have it, and also not too many times per week. Again, the back teeth can go on for a while. The teething process can be long and exhausting. All right, next up is things to avoid. This is probably my favorite part of the presentation because I really often worry about things that I see on the market at the pharmacies everywhere. Some things are not FDA regulated, even though they are offered at pharmacies or even children's stores. I've seen quite a bit of teething necklaces and jewelry that are sold. And FDA is very clear about this. Unfortunately, teething jewelry can cause choking. And further, let's say the child is in the living room, you're in the kitchen cooking, and they have that teething necklace, God forbid, they can strangulate themselves. And this goes on for a long time. So be really careful about those for those reasons. If you are wearing it yourself as a teething necklace, be really careful that the child is biting on it with your supervision, strict supervision. Again, it's not our favorite. I don't recommend it. Big, chunky plastic and silicone teethers are going to be a lot safer that the child can hold with their hands. You want to have a couple in your bag, couple in the car, on the stroller. I would encourage you to use those over the jewelry. Then this is another big one I've seen at the pharmacies everywhere. There are a ton of creams and gels and oral gels and things like that that are marketed towards teething parents, because teething parents are desperate. You're exhausted. You haven't slept in months, and anything to give your child some comfort. Unfortunately, most of them don't do anything, and this is where we're going to go to the next slide, and we'll talk about why not. So, two big reasons. First of all, baby's mouth don't have a lot of retention. There's a lot of slippery gums. As soon as they put this stuff on, it's going to wash away. So the child's going to swallow it all and they're going to get absolutely no benefit from it. So that's the most important reason. Secondly, unfortunately or fortunately, there is local anesthetic type called benzocaine in a lot of these over-the-counter medications. And they can cause serious medical illness. And there's something called, I will not bore you too much on the details, it's called acquired methemoglobinemia. It happens in some small fraction of population where if they ingest benzocaine, their hemoglobin is no longer able to carry oxygen properly. This might be as simple as getting blue fingers and blue lips and signs of the child not getting enough oxygen, or God forbid, can be absolutely life-threatening. And of course, this is something that's happening in a home setting, so it's really scary. They can start nausea, vomiting, seizures, God forbid. This is, and for that small fraction of the population, because we have no idea who this is going to happen in, I really caution you against any of these over-the-counter medications. Again, ibuprofen, Tylenol, sadly, are the best we got for nighttime relief every once in a while. But those home remedies of cold foods and massages are going to be, generally speaking, the primary mode of soothing. That's the chunk of the material, but I'm getting some questions on the side. So if you guys like, I can go ahead and answer some of those, and then I'll field it back to Allison. So one mom is telling us about the teething mittens. Those are really lovely. They wear them. It has a little plastic silicone up top. Those are a really good one. Absolutely, Mama. That's a really great recommendation. One mom is asking us, how early do babies start teething? We covered that. It's around 4 to 6 months. And we're going to have this recorded for your benefit, I believe. So hopefully you can access that, the earlier slides. And then another mom asked us, is there a particular baby toothbrush you recommend before they get their tooth? Absolutely. So those finger silicone type of brushes are fantastic for those first two bottom ones. Those are usually the first two that come in on the bottom. They're excellent for that. And the little ones love the feeling. It's, again, just like a teether. As soon as they start getting their top teeth, once you start seeing both top and bottom front, I start switching to a regular tiny soft bristle toothbrush for our little ones. And as soon as they have molars, none of these silicone ones are sufficient. We need real bristles that can get into those grooves and clean them very well. Mom asks, do you know rough guidelines for how many days of Tylenol per week to limit to? I actually don't know the answer to this question. I think it's a good question for the pediatrician. I apologize. I encourage you to limit it as much as possible for the bad days. Depends on the patient too. Sometimes they might have, God forbid, liver issues or other medical conditions that would just not allow any form of Tylenol or ibuprofen. So for use of those two medications, I know they're over the counter, but it's a good idea to check in with your pediatrician nonetheless. Another mom asks us, should we be using toothpaste with the first couple of teeth? Absolutely, you can start with a training toothpaste. Training toothpaste is, generally speaking, referred to mild flavored, non-fluoride toothpaste. It's a good time to get child familiar with it. And as soon as they have a couple more teeth, American Academy of Pediatric Dentistry recommends about a tiny little bit, like a rice grain amount of fluoride toothpaste before they're able to spit. And that's one of the big topics we talk about in the child's first visit, how to go about oral care. Okay, so any other questions at all?
Did you see the one about Oragel has benzocaine-free gel? Is that okay to use?
Oh, I'm seeing that now. I apologize. Thank you for that. I didn't see it earlier. That's great that they're offering the benzocaine free. That's helpful. At least we're avoiding the big risks. But unfortunately, just like we talked about, the gums are slippery. As much as you're going to put on there, sometimes less is more. You're not going to see much benefit from these over-the-counter medications, unfortunately. Any other questions that are coming through?
Well, while we wait for a couple more questions to come through, we can talk about our special offer. So Alameda Pediatric Dentistry has been serving families since 1971. So we're celebrating our 50-year anniversary, 52. And we do have a special offer during the months of March, April, and May of this year. So because this first visit is so important for so many reasons, and they do recommend bringing your child in for their first visit by age 1, or when the first tooth comes in, whichever comes first. We do want to help families bring their kids in. And to do that, we're offering a complimentary first visit for babies age 0 to 2 in our Alameda and Oakland locations. So that will include the full exam, the cleaning, and fluoride if needed. And it's just a great opportunity for you to come in, meet the dentist, see the facilities, ask any questions you have to our amazing pediatric dentist. And, you know, we won't bill you or your insurance. This is totally complimentary. It's something we're really proud to be able to offer, and excited to have some new babies come in and see us.
Thank you very much, Allison. We have one last question. It's a very good one, so I'm going to quickly answer that. When in the day should we brush the teeth? Fantastic questions. As soon as the teeth come in, we love brushing after the last feed. And I know around age 6 months, babies are oftentimes breastfeeding or they're bottle feeding quite a bit. Because that usually they get a good chunk of sleep after that, even if they're waking up in the middle of the night, we want the teeth to be clean at the very end, and then in the morning, perhaps after the first morning feed, it would be ideal to brush their teeth at that time as well. And then once they start having a good chunk of teeth and you're able to slowly wean off that middle of the night feed, we want to make sure that they are brushing their teeth, they're going to sleep, and if they're waking up, perhaps they're getting warm water. Again, that's after 12 months, but not too much milk in the middle of the night. So after the last brush is the ideal perfect time to brush their teeth. We have another mom telling us, it seemed my kiddo was teething at 4.5 months, but when the signs stopped and she hadn't gotten her tooth yet. Is that possible, or was it something else going on other than teething? It could be something else. However, generally parents are very good at reading their babies. And yes, it's completely possible. The signs stop, not much happens, then it starts again, and then all of a sudden the tooth comes in. So I tell you, with my little one, the molars killed us. It took a couple of months. It was multiple rounds, and it really gave me a lot of sympathy for what families are dealing with at home. Same with the canines. He's been working on those for months. And last night there was just dollops of drool on our table. So I know it's coming, at least another round of it. But just be patient. And another mom asked a really wonderful question. When do we shift from brushing once to 2 times a day? You know, when the first 2 come in, you just are getting the child used to it. Those bottom teeth, you want to start using the training toothpaste at night. And then in the morning, I think this is going to go slowly with the feeds. So around 6 to 12 months, when you're starting to make those transitions, it would be ideal to get, when you're getting on a schedule as a family, slowly but surely to brush in the mornings as well after the morning feed. So after the last feed at night and after the first feed in the morning. So it's similar to us, in dinner we brush, and then we have breakfast, then we brush. So those larger chunks of the day when we're not eating, the teeth can be clean and have it break. Any other questions at all? This has been such a wonderful crowd, extremely helpful, educated questions, and I really hope that you benefited from this. And if you come to see us or anyone else, we would love to see you, of course, and meet you in person. Please do mention us to us if you come. I personally work in both our Oakland and Alameda office, and I genuinely hope I get to meet some of you. And we're always available by email, phone call. Any form, we can be there for you. A lot of us at this practice are women, and most of us are moms. So we hope that we can be part of your tribe.
Thank you so much, Doctor. We appreciate you. We can't wait to see you guys at Alameda Pediatric Dentistry. Thank you everyone so much for joining. As mentioned, we'll send the recording and slides after this for anyone who may have joined late or missed it or want to share with their friends. Thank you so much again for joining, and thank you so much again, Alameda Pediatric Dentistry, for sponsoring us.
Of course.
Have a great day, everyone. So, bye.
Have a good weekend.
Thank you.